and so here, Tala is joining us. And how many students? 12. Okay. 12, no, 11 students. And who is the 11th? Is Mandil Hussein here?
No, doctor, he's not. But
I can see only 11, no, 10 classes. So there are.
we are 10 students.
So okay, I mean Abdel Rahman, Ahmad Sami, Zeynep, Zeyna, Mohammad Viam, Sadin, Tala, Halil, Mahmoud Kamel Yahya, Muhammad Aib, Muhammad Nabil, Kuralay. Who else?
One student joined from 2 devices.
Doctor, I joined twice.
Who?
Tala.
Tala?
Yes.
I see. Okay. Well, now, so we've discussed the no. Yes, so we have something to do with the diagnosis. I mean, history suggests what kind of disease? Yes, Zena?
Maybe flu or cold.
Cold or flu? Yes, some kind of respiratory disease, right?
Yeah, and chest infection.
Infection. And also it can be some kind of pulmonary edema or asthma. It can be asthma. So, and now let us move to the next slide. And here is the question about this kind of aspects of recording a case history. So the doctor was asking a lot of questions. So why are the past medical history, family history, social history, and drugs and allergy history important? Why is it important? Yes, Mahmoud Khalil, please. Khalil.
To try to predict any future diseases.
To protect whom?
About the patient, if he will get like a disease in the future. It's important to know any previous like allergies or family history.
So yes, if a doctor prescribes some medications, he would be should be aware of so the allergy history, drugs history, right? Okay, so Mohammed Nabil, please. Would you like to?
Also to give a right decision for according to the patient history, which is needed. What the patient need for according to the suitable decision.
For example, so if we know something about the family members, about their diseases from the previous generation, for example, so the doctor can predict some conditions because some diseases are inherited from the parents. So it's very important. Okay, well, does anyone else want to say, to add anything? Okay, And we'll speak about the importance of getting the information about social history today. And now, so the doctor and the patient were discussing some signs and symptoms of the disease, and we should differentiate between them. So a sign is an indication of illness that the doctor sees, but which is not sometimes apparent to the patient. So a sign is for a doctor. So the doctor can see this. A symptom is what the patient notices himself or herself. So what the patient feels and what the patient says about the symptoms to the doctor. Sometimes signs and symptoms, just signs can be classified as symptoms and vice versa. So it's hard to differentiate between them. Let us try to do this like here on this slide. There is the description of condition A, and here are 5 signs and symptoms. Let us decide whether these are signs or symptoms. Sometimes they can be both. Well, I would like to comment on this condition. Yes, Sadine, please.
The first one, blocked nose, it's a symptom.
What about the others?
Second one,
The connection is not very good. Will you repeat, please, about the second?
number 2, raised temperature, it is a sign.
Mhm.
Number 3, tender over sinuses, it is also a sign. Number 4, headache worse on bending, it is a symptom. And runny nose, it can be a symptom.
Okay, let us check. Okay, yes, you're right. So because a patient can feel headache and see runny nose, blocked nose. Yes, sometimes people feel that the temperature of the body is raised. Sometimes only the doctor can measure it and check, and then this is a sign for a doctor. The patient doesn't feel it. And tenderness over sinuses. This is the patient. The patient has a blocked nose and he doesn't know anything about sinuses. But when the doctor examines the patient, so he can see this tenderness. Well, good. And so the next condition, condition B. So also 5 signs and symptoms. Which of them are signs? Which of them are symptoms? So who would like? Yes. Let us listen to Abdel Rahman Hamid. Yes, please.
Okay, doctor. First one, raised blood is a sign. And second one, recent vomiting, I think it's symptoms. Third one, dehydration is a sign. And the abdominal tenderness, it is a sign also. And the last one, I think it's symptoms.
Symptom. Crampy abdominal pain. Any other opinions? So Mohammad Biam, do you agree? Mohammad Biam,
Yes, doctor.
you
I
agree?
think no, I don't agree actually.
What do you disagree with? Which one?
I forgot about it, but I had one problem, but I forgot about it.
I see. Okay.
Sorry.
So, well, let us check. Here, well, as for the raised pulse, sometimes people feel themselves. Sometimes only the doctor when he's doing checkup, so he can understand the raise of pulse. So it can be both sign and symptom. Of course, vomiting and diarrhea are symptoms because this is and recent. This is what the patient tells the doctor about. So this is 100% symptom. Dehydration. People do not notice whether they are dehydrated. So only there are some signs for the doctor, just like skin, condition of skin, and dry skin, dry mouth, that the doctor sees that the person is dehydrated. The same is about abdominal tenderness. When the doctor examines the patient and touches his abdomen, and this is the sign for the doctor. And pain is always a symptom because this is what the patient feels himself or herself. Well, and so the question, which diseases the signs and symptoms might relate to? The first condition, condition A. So what is the disease as doctors? What kind of disease can you think of? Blocked nose, temperature, okay. So this is Mohammed Nabil, please.
Yeah, you mean that maybe rise temperature?
Yes, but this is a raised temperature symptom. But what is the disease? You as a doctor, you know everything about this person, and you should start treating the patient, just prescribing something, some medicine. What kind of medicine are you going to prescribe? I mean, you should first understand the diagnosis, the disease. What is it? No ideas with a runny nose, raised temperature, and headache? Can it be a cold?
Flu?
Flu, cold, yes, right. Or as far as this is tenderness over sinuses, it can be sinusitis. So this is the name of the disease. And condition B. Now the problem with the abdomen. What is your diagnosis? Any ideas? So can it be, for example, do you know about any diseases that give such symptoms that are located in the abdomen? The pain is in the abdomen. What kind of diseases are they? Well, I would think of gastritis. Is it possible? Yes.
Yeah, it's possible.
Some kind of problems with the digestive system, indigestion, or appendicitis, also possible here, because this is because of the abdominal tenderness. So, well, yes, and well, if we think of a pneumonia, so let us make a list of the signs and symptoms that we would expect to see in a patient with pneumonia. So, do you know what pneumonia means? Yes, okay. Now, please, 1 minute to you to make the list of signs and symptoms. Start, please, now. You write, and then we will discuss. Well, so let us listen to Tala. Tala, hello.
Yes, teacher, I'm here.
Mhm.
Yes, about is the definition. It will be it's infection that influence the lung and the air sacs, and the scars of the mayful pool with fluid are causing symptoms such as cough and fever and chills and trouble breathing. And the
So
scientists of
the symptoms are what? We'll repeat one more time. The symptoms.
it will be which may produce something problem breathing and fever,
So
sweating,
problem
and
with breathing. Mhm. Then what?
yes, and sweating and
Sweating.
chill, yes,
Uh-huh.
and repeat and sharp or chest pain,
Chest pain.
and
Mhm.
yes, and low energy
Mhm.
and loss of appetite.
I see. Okay. Well, what about temperature of the body? Is it normal?
It's about the energy. It will
I'm
be
speaking
in
about
this side,
increased temperature. Will we see this symptom, like raised temperature?
how will be like.
No. Oh, I see. You know better. You are a doctor. Okay. So can anyone
Fever may
add?
rise a height of dangerous. It will be 1.5 degrees.
Mhm. I see. I see. Okay. Mhm. Anything else associated with pneumonia? Mhm.
I can add.
Yes, please, Zaina.
So for the symptoms, I said the cough, shortness of breath, loss of appetite, fever, and vomiting a lot. And
Vomiting.
for signs, maybe the doctor needs to check if there is weak immune system, like weak immunity, or the amount of oxygen that your blood has or you're
Mhm.
receiving. So yeah,
Mhm.
these are my signs.
The oxygen is low. Mhm. Yes,
Yeah.
because of the breathing problem. Yes. Okay. So good. Great. So we understand what to do in this situation. Now, let us focus on the other aspect here, how the doctors talk to their patients. And when you, as a doctor, speak to patients, you need to use non-technical language, the language that the patient can easily understand. Let us look at 2 example questions from the case history. So there are 2 questions, and with the words which I highlighted in bold, which verb means precipitate and which verb means start? In the first sentence, when do the attacks come on? When do the attacks come on? Come on, is it precipitate or start? Start, yes. And are you aware of anything that triggers the attack? The word triggers is the same as
Precipitate.
precipitate, yes. It means sometimes if you say what just precipitated, what factors precipitated the attacks, the patient may not might not understand you. That is why it's better to use another language like triggers, more common. And well, if we have a look at this slide, we can see here the practical exercise where we need to replace the technical words which are given in italics and highlighted in blue. We should replace them with non-technical words from the list. The list of the words is given to the right, and you may sometimes change the form of the word. Let us focus on the first sentence and listen to Horolai. Read the first sentence, please.
Okay, we're going to have to perform a few tests. We can switch the word perform with do. So it's going to be, we're going to have to do a few tests.
Exactly, you are right. Do sounds like easier to understand. Now, please let us do this exercise individually. You write on paper the missing forms, and then we'll check 2 minutes to do this task. Start, please. Now it's time to check. Will Abdelrahman, the second sentence, read it, please. Abdelrahman.
Okay, Doctor.
Mhm.
Richie suffering from bad flu. I think.
What do you think? Instead of suffering, which word is better to use here? Or just which word has the same meaning?
I think have good.
Okay, and so if we speak about she, it should be not have, but we'll read the sentence. She
has got.
She has got a very bad bout of flu. Right. Good. So Ahmad, please. The next sentence, number 3, is for you.
Yeah, it might be a good idea to avoid fatty food for a while.
Exactly. Avoid fatty foods. Good. Zaina, please.
He is prone to many minor illnesses.
Instead of susceptible, he is prone. Okay. Then Mohammad Diam. Sentence number 5, please.
Number 5. You said the code is no.
Intermittent. What does it mean?
The last one. What? Admit.
No, no. Who can help us with the sentence 5?
Or come and go.
Yes, if we use to come and go, we need to adapt this form to the sentence because this is present simple and we say cough, eat. This is third person singular. So we need to add what to the verbs. We need to add s, right? You said the cough. Muhammad,
What,
yeah.
doctor? The
Uh,
cough.
Yes. We need to
come
add s at the end of the verb. You said the cough comes and goes.
Goes.
Right?
Okay.
Mhm.
Okay.
Okay, the
Sorry.
next is Sadin.
Your cough is persistent. We change it with there all the time.
Yes, there all the time. So the next sentence is for Tala, please. Tala.
It's difficult to tolerate any kind of life change. It will be do.
No, we've used do. Change.
It's difficult to do any kind of life change.
Did you say stick? Yes, right. It's difficult to stick to any change. Okay, so Khalil, sentence number 8.
Okay, you won't have to be born, maybe?
No.
Oh, you won't have to be admitted, not born.
Admitted, yes. Admitted when the patient comes to a hospital and the medical professionals admit him or her. Well, and the next is for Muhammad Aib.
You are scheduled to see the nurse and the allergy clinic next Tuesday. I think it can be you are prone to see the nurse in the allergy clinic next Tuesday.
No. We've used prone in sentence number 4. He is prone to many minor disease illnesses. Like
You are booked to see.
yes, booked to see.
You are
Because schedule means to plan something for a certain period of time in future, to put something on the schedule. To book is the same, to plan, to put some event in your future timetable. Okay, so these are the words, different words. The blue words are more formal. The words to the right are more conversational, and it's better to avoid formal words and use these words that we replaced so in the sentences. And well, now I would like you to think of how to role play a conversation between a patient who has a flu or a cough and a doctor. The doctor should follow the Socrates model in asking the questions about, you remember, place, onset, duration, factors associated with the current condition. Well, and also the doctor should use easy to understand language, non-professional, non-technical words, and can use these words like when, is there, and so there are some examples. Are you prone to? Are you booked to see? Do you find it difficult to stick to medication? Does your cough come and go? And others. Who would like to be a doctor? Let us listen to Mohammad Nabil. Hello.
Yes, doctor.
You are a doctor, and Huralay will represent a patient. Start, please.
Okay. when did you feel the symptoms for the first time?
I started feeling some symptoms 2 days ago.
Okay, is there anyone of your family with the same symptoms?
Yes, my sister had runny noses starting from today.
Did you no? Do you have animals in your home?
No, we don't have any animals.
Okay. Have you?
Doctor, are you still here?
Yeah. Have you ever?
Doctor, you may ask another doctor to help you. So who can help with the questions?
Just a minute. Just a minute.
I see. Okay. It's not easy. Maybe the other students can help in asking questions. So we find out that the patient has got runny nose and sister also has the same symptom. What else can we should we ask about?
Do you have any pets? Maybe.
He've asked. She doesn't have any pets. Yes, Zaina, what do you say?
Did you take any medication in the previous 2 days?
So, Coralie?
No, I didn't get any medications, but I used a hot shower.
Okay, hot shower. So, and did it help, the shower?
No, it didn't help with my temperature, but it helped me to sleep good.
I see. Just so, can we suspect cold or any allergy or asthma or what? We should differentiate between these diseases. Just we need some extra questions. What are they? Okay, so Mohammed Nabil, if a doctor doesn't understand what's wrong with the patient, what should the doctor do? Nabil.
What?
What should the doctor do in this situation? You don't know, you don't understand the diagnosis. Should you do any tests?
Yeah, maybe in the lab for the patient, for about his blood, and
So,
yeah.
Tell the patient.
Yeah.
Tell her. So you should say that we are going to do some tests just with your blood, and what do you say?
Doctor, and also he can make X-ray for his chest.
Yes, to examine her chest, right? Well,
maybe ask another doctor.
About what?
I said maybe ask another doctor with him.
Another doctor, yes. So another doctor, and say, how do you say this? Like, well, I'll just wait a minute. I'll just consult another person, more professional person. Yes, because it's very serious condition. I mean, the patients come to surgery with very serious conditions. And if you don't know anything, you should ask a more professional, senior doctor.
Please ask more professional doctor there.
Yes, for
I'm more
consultation.
professional. Please ask me.
Yes, who are you? What's your name?
Kila, I want to ask Muhammad.
Yes, we are asking you. How can you help?
Me, doctor.
Yes. Okay.
Wait.
Well, unfortunately, we don't have time to listen to more professional